What's vision like for patients who have glaucoma? Can they see at all? In this video, I'm going to show you how patients with early glaucoma, moderate glaucoma, and advanced glaucoma experience the world. The rates of glaucoma are going up in the world, so it is very likely that you probably know someone who has glaucoma or is a glaucoma suspect. If you're new to the channel, my name is Dr. Saya Nagori. I'm a board-certified ophthalmologist and a fellowship-trained glaucoma specialist. For more information on all things related to eye health, remember to hit the like and subscribe button below. Thanks for being here. Now, before I get into exactly how glaucoma patients see when they have different levels of disease from early, moderate, and all the way to advanced, I want to let you know that glaucoma is a typically slowly progressive disease and it causes irreversible vision loss. It's very treatable, but it's not curable. So it is really important to get screened for it. Now let's go through how a person with different stages of glaucoma would view this same exact image or scene. In early stage glaucoma, the patient will likely see a scene like this. You may be thinking, wait, isn't that the same image as the original one? Yes, you are correct. This is because in very early stages of glaucoma, most patients have no symptoms at all. In order to detect early glaucoma, you actually have to have testing done in the eye doctor's office. The eye doctor can find subtle changes in the health of the optic nerve. We can also do different tests to see if there are early risk factors for glaucoma, such as high eye pressure. It's important to note that high eye pressure is a risk factor for glaucoma, but it's not necessarily synonymous with glaucoma. So patients can actually have glaucoma even with totally normal eye pressure. So it's important for all these other screening tests to be done in the office as well, because as you saw with the image, most early glaucoma patients are not going to have any symptoms. Now let's move on to moderate glaucoma. In moderate glaucoma, patients have lost some of their functional peripheral vision, and they may actually notice the vision loss. This is a second image of how someone with glaucoma may experience the world. Now, as you can see, the sides of the image are blurred out, and patients can have visual field loss in their nasal visual field, as well as their inferior visual field and superior visual field. Temporal visual fields, which is the vision that you have out here, can also get affected, but this usually happens a little bit later as the disease gets worse. Now let's move on to experience what vision with glaucoma is like when a patient has very advanced glaucoma. And here's that image right here. As you can see with this picture, the patient has a very narrow view of the world. We often refer to this as tunnel vision or central sparing, which means that only the central vision has been spared by the disease. The peripheral vision has been largely obliterated, but their central vision does remain intact. Patients will often say that they don't know if someone is standing right next to them unless they are standing very, very close to them. They also can have a lot of difficulties maneuvering around their home, and they may bump into things that they didn't realize were there. Now, surprisingly, even in these very advanced stages, a patient can still be 20/20, and they may still have perfect central vision. And that's what's so scary about this disease, is that you can be walking around with 20/20 vision and still be having very severe glaucomatous vision loss. This can provide a really false sense of security because you can have really good central vision and then just a few weeks or months later progress into total vision loss. In extremely advanced glaucoma, the patient's entire visual field is blurry. They may only be able to distinguish hands moving back and forth, and this is called hand motion vision. They're not able to see any letters on the chart. They can also maybe only see like how many fingers someone is holding up in front of them, but seeing something on the chart may not be possible in sort of those final stages of glaucoma. Now, while glaucoma is an absolutely terrible eye disease that causes irreversible vision loss, it is actually very treatable, and we have a ton of more treatments now than we did 20 years ago. The biggest problem here is that patients are diagnosed very late, and that is because they don't know that they have glaucoma, and glaucoma often doesn't have any symptoms in those early stages. And we do know, according to many studies, that treating glaucoma early means that patients will keep their vision longer. Getting routine eye health exams with a dilation, especially in your 40s and 50s and beyond, is very important, even if you don't have other health problems like diabetes or high blood pressure. So be sure to make an appointment with your ophthalmologist and ask them what your optic nerve looks like. Hope you found this interesting. Remember to subscribe below, and I'll see you in the next video.